My name is Dr. Lydia. I'm the clinical vet here at Horse Plus, and this video is going to be a debriefing from the group of buyout horses that we took in this month. Normally our RVT Nicole is here with me, but she is busy processing blood samples for me. So I'm gonna go over physical exam findings from the horses that we took in today, as well as findings on radiographs. I don't have blood work results back or culture results back, so this will be a less complete set of information that we'll have in a couple days. But we believe in naming animals, and these guys are all gonna get assigned names. However, because we just intook them today, they're still only identified by B numbers. So I know that's impersonal, but we promise we will name them. These guys were diverted from slaughter auctions, so there are some hard calls. Although today we had a much happier overall, many more horses turned out into pasture than we have in previous months. So there were a couple hard calls, but I'm gonna talk about them. So our first number is B25, 242. He was at least 30 years old, probably mid-30s. He was a standard jack donkey, intact male, and he was very obviously painful from the second he came off the trailer. Thankfully, nobody was down in the trailer this time, which was great, a lot less traumatic for the patients and for our staff. So this little guy had severe slipper toe on all four of his feet. He was leaning back. He was having difficulty moving around. His heart rate was in the 50s, which is elevated. And he was so painful, he was kind of like almost collapsing on his front feet. We immediately gave him pain medication. If I say an animal's painful and I don't state that we gave them pain medication, we do. They all get pain meds. If they show any indication, then they need it. So he got pain medication, a little teeny tiny bit of sedation. We took foot radiographs, and there was severe advanced laminitis. He had bounding digital pulses on both of his front feet, and he was given the last act of kindness. Our next horse, B25 243, is an 18-year-old draft cross gelding. He's a very big, handsome boy. He's bay. His body condition score is less than ideal at 3 out of 9, but not as skinny as some of them that we see. And he was a little bit pushy, but otherwise he was a very good boy to work with today. His resting heart rate was almost normal at 40, just a little bit elevated, but there was a lot going on today. His heart and lungs sounded normal. His lymph nodes were within normal limits. Gastrointestinal sounds were increased in one quadrant, but normal in the other 3 quadrants. And his mouth seemed pretty normal. His left hind limb is very enlarged from the hock down. Looks like a stovepipe leg. And he had a pretty sizable scar on the lateral, dorsal, and medial aspects of that leg. He's a little bit off on the leg, but not overtly lame. And he mostly appeared to be very comfortable at the walk. I took radiographs of the affected leg and saw a little teeny tiny bit of arthritis and some indications that there had been an injury in that area, but for the most part, all of his bones looked great. And I was really happy with that. He's very stable. He is down to have his leg fully clipped. I clipped it a little bit, but he needs the whole thing clipped, scrubbed. He's scheduled for an ultrasound of that left hind leg and a dental just to make sure his teeth look okay. And he got turned out to decompress in a pasture. B25 244 is a 16-year-old quarter horse gelding. He's black. He has a little snip and socks on his hind leg and a little bit of white on his right front leg. He's very sweet and well behaved. He was easy to catch, bright, alert, responsive, halter trained, normal heart rate and respiratory rate. He does have a low-grade heart murmur. I graded it at 2 out of 6. So any heart murmur of 3 or above, I scheduled them for a cardiac ultrasound. His was very, very mild. He appeared to be well hydrated. His GI sounds were normal. His hair coat was in pretty poor shape, like he had been neglected. His hooves were overgrown, and he was very thin. So I body condition scored him at a 2 out of 9. The most notable thing on his exam was that in his hind legs, his pasterns were very upright. So he had poor conformation, a little bit like Alfie from last month, if you watched Alfie, just kind of a little bit of a lemon conformationally, but a really good boy. And so when he was standing up, his hind legs don't look normal, but they're not causing him discomfort. So he is scheduled for a dental. We're gonna take radiographs of his hind legs just to make sure we're not missing something there, but he seems really comfortable. And actually, I did put him down for a cardiac ultrasound, even though his murmur is very mild, just because we have it and we're able to do that diagnostic in-house. But overall, he was a very good boy and he seems to be in decent shape. Our next horse is B25 245. She is a 23-year-old standardbred mare. She's all black with a star and she has a brand on her right neck that is 6DD84. Small side note, we did not have the time to look up her brand, and aging based on dental health is extremely subjective. So I did my best today to guess her age based on her teeth, but I could have been way off. So if you're watching this and you look it up and go, oh, she's 24, not 23, or, you know, I always hope that they're younger than they are. This mare has scars over her right hindquarters, a lot of kind of linear, choppy, probably like 20 scars over the back of her right hind limb. And then she also had some scars over her right hind leg. She is completely blind in both eyes, but her eyes were not painful and they appeared to be stable. She was halter trained, bright, alert, responsive. She initially did not like to be touched. She was really pinning her ears, but with just a couple minutes of some talking to her and gently touching, she was lovely to work with and was a very good girl. She looked like she had had an old abscess in one of her hind legs, the left hind leg. Body condition score of 2.5 out of 9 is quite thin, but she was sound at a walk, and other than a little bit of some mild nasal discharge, there weren't any other major things wrong. So we sent that nasal swab off for culture. She's down for a dental and she is turned out in pasture to decompress. Our next horse, B25 246, is an approximately 20-year-old chestnut Tennessee walking horse mare. She has a star and a snip on her face. She is also completely blind, but very, very well adjusted and without painful eyes. So if you've watched Horse Plus videos, we get a lot of blind horses with very painful eyes, and that sometimes necessitates not necessarily emergency surgery, but kind of like as soon as possible, we have to take those eyes out. Both of these mares that we got today, I did not schedule for surgical removal of their eyes because I don't see any indications that they are causing pain or discomfort or a problem. This mare had a wound on the lateral aspect of her left front leg, which she allowed me to clip. I scrubbed it up with betadine and put some ointment on it. We did take a radiograph of the wound and did find that it was quite deep, but it didn't appear to be communicating with a joint or a synovial structure, and it already looked like it was healing, on its way to healing. She was a bit base narrow behind, so her hocks were kind of touching when she was resting and then a little bit toed out conformation, and she had quite a bit of scarring on her vulva, probably from previous foalings, and we did know that her tail tendon had been cut and there was a big scar on the bottom of that. She also has a big patch of ringworm on the left aspect of her muzzle that's usually pretty self-limiting. So she is down to have a dental, and she is turned out in a quarantine pasture to decompress. This mare actually, within the first 15 minutes, had figured out the whole perimeter and where the water was and where the hay was all by herself. So she's doing great. Oh man, this poor little guy. So B25 247 was a 26-year-old Jack donkey, also a little stud. He was a little blue roan. He was very, very cute. And I wrote down sweet and resigned. He did not feel well, this poor guy. He was dull to depressed. He was quiet, alert, and responsive, but he was not feeling well. He had an elevated heart rate. He did receive pain medication. He had elevated cranioventral lung sounds on both the left and the right. He was noted to be coughing, and his incisors were worn completely smooth. So his front teeth were worn very, very close to the gums. He had cataracts in both eyes. He had a lot of scarring on his integument. His hooves were very overgrown, and unfortunately, he also had active digital pulses in both his left and right front. He was painful and very reluctant to walk, even with those pain meds on board. And when we took radiographs, the first side that I looked at, the left side, I went, oh, it's not so bad. And then we took a radiograph on the right side and it was much, much worse. And unfortunately, we also identified that he had a pellet, looked like a birdshot pellet, under the skin on his right front leg. So someone shot this poor little guy at some point, which was not the reason why I made the call to give him the last act of kindness. The digital pulses indicate that he was actively undergoing laminitis, which is a painful, chronic, progressive condition. It can be treatable if we catch it in early stages, but in this guy's case, he was so painful and didn't want to move at all. And also at 26 years of age, he had been suffering for a long time. B25248 is a 1-year-old baby donkey. He is very cute. He's dark brown. He is presumed to be intact. I did not see testicles, but he's a baby. So I'm not assuming that they haven't just descended yet. He was really nervous and high alert, a little bit hard to catch, but once we had him in our chute system, he calmed down and was pretty sweet and let us do most of what we needed to do. His respiratory rate was a little bit elevated, but he was scared when he was in, but he did have increased lung sounds in both left and right, and he was observed coughing. He had all his baby teeth. Oh, this is the one. I thought he had a big scab under his jaw, but it was just a burdock, so I pulled it off. He has dermatitis on his ears, on his face, and a lot of scabbing areas. And then he had a wound on the front part of his right front leg that looks like it's well on its way to healing. So he has turned out just with another donkey friend. Donkeys, we have found, are very susceptible to equine influenza, and it can make them really sick. Even though these guys came in with horses, we like to keep them separate. So hopefully we will get him better. B25249 is another little donkey. He is also young. I aged him at 1. He unfortunately has a big abscess with a draining tract under his jaw. So we worry about strangles when we see abscesses in that area. Strangles is a bacterial disease caused by Streptococcus equi. So I took a sample of that. We don't have those results back, but it looks suspicious to that. He also was hard to catch, but once we caught him, he calmed down and he really liked being scratched. So somebody had worked with these guys. He does have, interestingly, a grade 2 out of 6 heart murmur. So heart murmurs are much less frequently seen in young animals, but his was very mild. His lung sounds were within normal limits, but he also, I didn't write this down because I observed it after we turned him out, he was also coughing. But other than the abscess under his jaw, the rest of his physical exam was normal. He didn't have a fever. I do believe that he is intact and needs to be castrated as well, but he's just a baby. So he has turned out with the previous baby donkey together in a field, and hopefully they don't both get more sick. This poor guy. B25250 was a 33-year-old beautiful liver chestnut gelding. Tawny thought he was a Rocky Mountain horse, which would be really cool. I love the color liver chestnut. He was thin. He had a grade 3 out of 6 heart murmur, and his heart sounds were very muffled, so it was pretty difficult to hear his heart. He had nasal discharge. He had decreased gastrointestinal sounds, and he was actively sucking air into his rectum, which is abnormal. He had no incisors, so his teeth were just worn to the level of the gums. And his left eye was very enlarged, and it's hallmark of glaucoma, but it's a indication that there's increased intraocular pressure. That just means your eye is kind of like a water balloon. It's like 2 little water balloons smashed together. And when the fluid builds up in the eye, the pressure increases and it can cause really severe discomfort. This horse obviously had a lot of pain from his eye. His heart rate was elevated. He did get systemic pain medication immediately. He was blind in that eye, and he had a lot of tearing and squinting associated with it. And he also was quitting. So if you've watched our videos, I talk about that pretty frequently. Quidding. It's when they kind of wad up balls of food in their cheeks and kind of drop them. And This guy did not want me to touch his mouth at all. He would not let me examine his mouth without sedation, even with pain meds on board. And we took some radiographs of his mouth, and he had severe dental disease. He had at least 4 teeth that were fractured. He had multiple areas of diastema, which is just a big space where a space isn't supposed to be. And when I palpated in his mouth, I actually could move multiples of his teeth. They just were that loose in his mouth. So because of his abnormalities in his gastrointestinal tract and his heart and his mouth and his eye, I made the recommendation to give him the last act of kindness. That I would have had to come out today. It was causing him severe discomfort, and I didn't feel like it was fair to him at his age and with the other things that he had going on to ask him to go through that major surgery today. He was a very good boy. He got a lot of cookies. B25251 is a 32-year-old quarter horse gelding. He's a beautiful Palomino. He is very, very sweet, easy to catch, bright, alert, responsive, halter trained. He has nasal discharge. He had really severe hyperperistalsis, which means his GI sounds were just gurgling, 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 and really severe diarrhea. He did not want me to look in his mouth, just like our previous horse. He had cataracts in both eyes with scleral injection and a wound near his right eye. Scleral injection just means the sclera, the kind of white part around his eye, had a lot of angry looking blood vessels, kind of red. He had DSLD, so deep suspensory limb desmitis, in his left hind. Usually when we see DSLD, it's almost always at least 2 legs, but this horse only had it in 1 leg. And he was very significantly lame in both of his hind limbs. The left hind was the worst. He had some furcations, which is where you can actually see the little, if you picture a tooth and the roots of the tooth, you shouldn't see the little U part at the bottom of the tooth above the gums. That's called a furcation, or the furcation is visible. So he had some visible furcations. He had mobility in his teeth. He had some diastemas. He had ulcerations on his gums, and his incisors were worn to the level of the gums. And so we just looked at his overall quality of life and went, this guy has a lot going on. But most significantly, he's quite thin, and I didn't think that I could fix his teeth. And so I recommended the last act of kindness for him. Man, same story, different horse. So B25252 was a very, very thin body condition score of 1 out of 9. Very sweet Tennessee walking horse mare. I aged her at 34. She could have been older, but she had no teeth, so it was really hard for me to make that call. She had big scars over her nose. She was pretty dull to depressed, very easy to catch, halter trained, super sweet, but you could tell she just didn't feel well. Her resting heart rate initially was in the 60s. It improved down to about 48 after she was given pain medication, but 48 is still abnormal. She also had a heart murmur, a grade 3 out of 6 heart murmur. Her lung sounds were elevated on both sides. She was pouring pretty prolific mucopurulent nasal discharge. She was coughing. Her gastrointestinal sounds were elevated in all 4 quadrants. So she also had hyperperistalsis, like that other older horse, with diarrhea. She also was dropping feed or just kind of standing there not eating and quitting. She wouldn't let me examine her mouth until I sedated her. And she also had really horrifically bad dental disease, all of the same things I noted on the other horse: furcations, diastema, teeth worn to the level of the gums, some fractured teeth. In addition to that, she had a very painful ulcer in her right eye called a melting desmetocele. That just means the cornea has been affected all the way through, and the cornea just kind of starts to melt. So it makes a pretty big, hers was about the size of a pencil eraser. Very painful. She was holding the eye closed. She also had a big hip a big abscess. It's been a long day. I've said a lot of words today. She had a big abscess that looked quite old, kind of on the side of her right hind limb. It was about this big, and you could feel that it was fluctuant. It felt like it had been there a really long time. Honestly, it looked like somebody had given her an injection of something there that abscessed, but that was the least of her worries. She was very weak and kind of stumbling. Her proprioception was normal, so she wasn't neurologic. Her central nervous system tested normal. She just was so thin and so weak that she just could barely stand. And heartbreakingly, she was so thin that her rectum had recessed. And when she was defecating, those feces were falling into the external vulva. So she had fecal matter in her external vulva, which can result in an ascending infection and can cause really bad urinary tract infection or kidney infections. Poor thing. So she was given last act of kindness after lots of treats, which she couldn't chew, but she sucked on them. Oh, this horse was interesting. Okay, B25 253 is a 15-year-old. That's the interesting part. I totally had to guess on this horse's age. Morgan Cross, very cute, dense little mare. She's a bay with a star and a snip. Her body condition score was a 5 out of 9, so ideal to maybe slightly above ideal. But I like a little chunky horse, and we're not used to seeing that at Horse Plus. She was halter trained. She was hard to catch, but once we had her caught, she was a very good girl and very cooperative. Pulse, respirations, and temperature were all normal. Her heart and lungs were normal. Her lymph nodes were normal. Her GI tract was normal. She had a tiny pinpoint ulcer in her left eye, but tiny, like just a little tiny bit. I did stain it and document that there was stain uptake, so I treated the eye with some terramycin ointment, but a normal, uncomplicated corneal ulcer heals in about 5 to 7 days. And she did have another scar on the same eye where it looks like she had another ulcer that was already healed. So I'm not super worried about that. She had some overgrown hooves, but very nice, shiny, good quality hair coat. She was sound and appeared normal at the walk and a little bit at the trot. Her external genitalia all looked normal. Her incisors were worn completely, but then the whole rest of this horse looked like a young, healthy horse. So this is where I'm thankful, especially for diagnostics. So we took dental radiographs, and all of her premolars and molars are just beautiful, perfect occlusal surfaces with no problems. So if you're super old and you have your gums worn, that makes sense to not have really perfect teeth. So I just totally guessed and called her 15. I have no idea how old this horse is. And we'll have to make sure that we document really well so that when she gets adopted, if some other vet just looks at her front teeth and doesn't look at her dental radiographs, they're gonna go, this horse is way older than you think. But I think she could be younger than 15. I just totally guessed. But she was a very good girl. She doesn't need any dental intervention. I'm really, really hopeful for her to go into our adoption program, and she has turned out in a quarantine pasture to decompress. B25 254 is a 4-year-old black Tennessee walking horse mare. We got a bunch of mares that looked very similar to each other. She was bright, alert, responsive, not halter broken, very nervous and hard to catch and pretty high alert. And she was very reactive to humans touching her. So I don't think she'd been handled a whole lot. Her heart rate and respiratory rate were both elevated. However, I had to do her exam in the squeeze chute and she was really fearful. So I didn't attribute those elevations to pain, but more to being worried that she was in there. I didn't hear any murmurs or arrhythmias. I was only able to listen to her heart safely on the right side because of where she was. Her lung sounds were normal. The GI sounds that I could hear were normal. And she had her incisors that erupt at 2.5 and 3.5 were out, but the 4.5s weren't out yet. So I aged her at 4. She's between 3.5 and 4.5. B25 255 is a beautiful 16-year-old Palomino mare with a blaze. I guessed that she was a quarter horse. She doesn't appear to be gated. Her body condition score was pretty great at 4 out of 9. She was halter trained. Once she was in a small pen, she was very easy for me to catch. She came up and ate cookies. She was very sweet with humans. She did kind of bully the other horses when they first unloaded, but it was a really stressful environment. And now that she's turned out in a pasture, she's being very appropriate and sweet to other horses. Her temperature, pulse, and respirations were normal. Her heart and lungs sounded normal. She does have some mucoid nasal discharge that we sent off for a culture. And she does have some mild ophthalmic discharge. She was a little bit dehydrated, just kind of in general, covered in burrs, really overgrown hooves, but she was sound at a walk and everything else looked normal. And I have her down for a dental. Probably this is overkill, but I'm also testing her for Cushing's disease because she did have a little bit of a kind of a crusty neck, which sometimes can just be normal, but that's a test that we can do in-house here, and I just wanted to rule that out. But she's a beautiful girl, and I'm really excited that she's here. B25 256 is a 24-year-old Tennessee walking horse mare. I'm really worried about this mare, actually. Her body condition score is only 2 out of 9, so she's very, very thin. And this is one of those ones where I just don't have enough information yet to confidently speak to what's going on with her. She's visual, but she's not quite right. So I wrote that her mentation was abnormal. She kind of stared into space and then would startle as if she had forgotten that you were there, which sounds very subjective. Her resting heart rate was 42, which is a tiny bit high, but not super high. Her temperature was normal. Her respiratory rate was normal. Her heart sounds were normal. She was coughing. She had nasal discharge and she had increased lung sounds. And her incisors were worn, but her back teeth looked great. So again, like that previous horse, we took x-rays to look at her back teeth. So 24 was a subjective age. I could be wrong there. She was visual, so she was menace positive, but she startled sometimes, especially on the right. So sometimes that's an indication that there's reduced vision, which I didn't see in this mare, although I didn't do a super thorough opto exam. She had very poor quality hair coat and some rain rot. And she was just kind of stiff in all of her feet, most significantly in the left front. She also had a delay in her proprioceptive placing. So proprioception is, does your brain know where your legs are in space? And if that's absent, you got neurologic disease somewhere in your brain or spinal cord. When there's a delay, it's a little bit harder to say confidently whether it's lameness or weakness or actually neurologic disease. So I actually sent this mare, I sent a bunch of samples off to test for some different viral and bacterial diseases with this mare. We're running an in-house CBC and chemistry. We cultured her nasal swab and we sent off some other blood tests. So I had enough concern that I kept this mare kind of by herself. I didn't turn her out into a quarantine pasture. I want more information about what's going on with her. I want to save as many horses as we can, keeping their quality of life in mind, but also making sure that we're not placing other horses at risk. So this is one that I just don't have enough information on to confidently say what's going on. But she is calm. She seems to be comfortable. She's eating really well. And so we'll just take it a day at a time. Probably by the time I'm done making this video, I'll have some of those blood tests back. The next horse is B25 257. She is a 4-year-old black Tennessee walking horse. She has a few little white hairs on her forehead, and she's missing a circle of hair just below her right ear. She was pretty nervous around people. She was jumpy and reactive, and kind of like the other black mare, her heart rate and respiratory rate were elevated, but I think it was more out of anxiety of being around people than it was out of pain. She did have some nasal discharge. She also had some swelling under her jaw that was warm and fluctuant, so that's a concern. She had some soft stool. She had just started erupting her 4.5-year-old teeth on both sides, so I'm pretty confident that she's about 4.5. She did have discharge from both of her eyes. She had a really poor quality hair coat. She had severely overgrown hooves, like years of overgrowth. This horse had a keratinized growth on the inside of her right front leg that Tawny was like, it's an extra hoof. And it did actually feel very much like as rock hard as a hoof. So I'm not sure what that little growth is. It's about this big. We took radiographs. It's just connected to the skin and not anything else. So that's something that I probably could surgically remove pretty easily, but it's very stable and not causing this mare any discomfort. So we didn't make that a priority. She also looked like she might have a very small umbilical hernia, but I wasn't able to safely palpate the area. So that is something that I think could safely be done at the same time, both of those surgeries, the hernia repair and the removal of that growth on the right front, but neither one of them are urgent, and she seemed very comfortable. She, we think, was nursing a foal, who is the last one we looked at today. We're not quite sure. The foal's pretty big, so could have been an older sister, but also could have been mom. B25 258. This is a very spicy horse. He already had a microchip. So we've had a couple other Mustangs come in through the Forest Service who looked a lot like this horse, had microchips with the same starting numbers as this horse. So we put him down as a Mustang. He did not have a brand. He had already been gelded. He was very high alert, very nervous, very wild and reactive, and did not want to be around people. So I really wasn't able to do a lot of an exam on him safely. He appeared to be sound and healthy from a walk and a trot, but I really, like I said, was barely able to observe. I'm also not super confident on his age because I had to try to look at his teeth while he was in our squeeze chute. But he got vaccinated and we pulled a blood sample on him, and we're gonna try to track down that microchip number to see if we can learn more. And our wonderful gentlers in our program, Trey, was here, and even in like 5 minutes, Trey was touching him and making progress. So very hopeful for this guy. B25 259 is a 15-year-old Tennessee walking horse gelding. He's black with 4 socks and a star. He was quiet, alert, and responsive, very sweet and halter trained. Temperature, pulse, and respirations were normal. Heart sounds were normal. He did have some nasal discharge. He had very strange poop, kind of a foamy gray looking abnormal ploppy poop. So not normal for a horse. We took a sample of that. He has a plaque of pitting edema on his stomach, which if you've heard me talk about it before, it's kind of like memory foam. If you push your finger in, it kind of leaves an indent that slowly returns. So usually that's not painful, but it's definitely not normal. And it can indicate protein loss. Sometimes it happens secondary to, like I see it most commonly in horses secondary to castration, where the swelling secondary to the castration kind of settles down under the belly. But we pulled blood for this guy to run some blood work on him to see if we can figure out what's going on there. He had some really severe hoof neglect, and I body condition scored him at 2 out of 9. It's a little bit deceptive on this guy because he has kind of a big pot belly, but you can see all of his ribs. So overall, I'm very hopeful for him that we can get him feeling better. B25 260 is a super cute little chestnut pony cross. She's only 4 years old. She also had readily visible ribs and kind of a big pot belly. So I body condition scored her at a 3. She was very nervous, but then once she was in our chute, she very clearly yielded to the halter and seemed to be halter trained, and she calmed down when you touched her, which was great. She had some mucopurulent nasal discharge, conjunctivitis with some redness and discharge. She had really bad rain rot and some hoof overgrowth, but otherwise all the rest of her physical exam was completely normal. I sent her nasal swab off to be cultured, and she has turned out to decompress. And then the last horse we looked at today, B25 261, is a little 7-month-old filly. This filly was with the 4-year-old mare I mentioned earlier. Whether or not that mare is her mom, that mare is letting her nurse, so we weren't really sure, but they're bonded and we kept them together. I have her down as curious but unhandled. Mom is also wild. So she was pretty high alert and nervous, but very curious and let us do what we needed to. So her heart rate was a little elevated, but for a nervous baby, I would call it normal. Her temperature was normal. Her heart sounded normal. She did have a little teeny tiny bit of nasal discharge, but no lymph node enlargement. Her gut sounds were normal. She also, like mom, had some eye discharge. She had a wound on the outside of her right carpus, which she let me clip and clean and medicate without any sedation. So that was a very good baby. And she had some mild hoof overgrowth, but she looked sound at the walk and trot. And so she got our full intake. Oh, I documented this. She sounded hoarse. So when she was whinnying, she was like, she had like a little kind of a hoarse voice. So I don't know if she just had been neighing a lot. We don't know histories on these guys, but she's very happy now. She's turned out, and hopefully she will make a full recovery and make it to adoption. So overall, man, this was a much better buyout group than many of the ones we've gotten previously. We do have some medical concerns, but I'm really, really happy. We didn't have anybody down in the trailer. We didn't have any fractured legs today. So sometimes these days are really heartbreaking, but I'm hopeful for these guys. And if you haven't heard of Horse Plus before, we get everything adopted out that we possibly can. So if you have space in your life for a horse, look at what we have for adoption and come see what we have that needs a home.